As our hospitals brace for a difficult stretch in the coming weeks, we are touching base with Valley Hospital Systems to see if they're ready for the increase in patients. ABC 15's Mike Pelton talking for the first time with Dignity Health Chief Medical Officer, and he joins us outside Chandler Regional Hospital. Mike?
It's a sign hospitals know what's coming. As part of their emergency preparedness plan, today Chandler Regional is setting up emergency tents that would be used to triage patients in a potential surge.
I'm quite concerned, and I think that's shared by all the healthcare professionals across the state of Arizona.
Dr. Keith Frey is Chief Medical Officer for Dignity Health in Arizona, and no surprise, says they are seeing more COVID patients.
It's gradually going up, has been for the last 6 or 8 weeks, and this past week it's continued to increase.
Dignity Health's hospitals include Chandler Regional and Mercy Gilbert, among others. Dr. Frey tells me currently they do have capacity and are not yet postponing elective surgeries.
We're on top of this. We feel like we can handle anything that comes at us, but we continue to be concerned that if the public isn't following all the public health guidelines, that we could get overwhelmed if we're not careful.
This week, new models compiled by researchers at ASU and U of A show statewide our hospitals could hit capacity in mid-December. Dr. Frey tells me during the summer surge, they did not have to go to a method of determining what patients get what resources, known as crisis standards of care.
We are hoping that we can manage the demand that's coming at us without having to go that, but it could very well happen, particularly with the holiday weekend next weekend.
And to slow the spread, Dr. Frey believes health and state leaders are on the same page about the importance of masks, social distancing, and avoiding large groups.
We're all in agreement on that and the science that supports that. Now, how we message that and enforce that, I think that is, you're right, it's a measure of debate, but there isn't any question on what the public should be doing.
And much like other health systems, Dignity Health is working to hire more nurses. They're also adjusting their visitor policy, which does have some differences between their 6 Valley hospitals. In Chandler tonight, Mike Pelton, ABC 15, Arizona.
Thank you, Mike.